Hi, I'm Michael Fisher,
And I'm Jack Maple-Lentz.
and we're starting Children's Home Infusion Pharmacy with our business partners Gevorg Martirosyan and Josh Lewis. I'm a freshman at Ivy Tech.
I'm a freshman at Notre Dame.
Gevorg is a senior at IUSB, and Josh is an Ivy Tech graduate.
Home infusion allows for patients to receive hospital-grade medications in their own home. A specialized nurse delivers the medication, teaches the caregivers how to administer it, and retrieves the supplies when treatment is done. We'll specialize in helping children with medical complexities, but can also provide healthcare for adults and even pets.
My nephew TJ has kidney necrosis, which means that he needs specialized medications and often receives lengthy infusions at Riley's Children's Hospital. Having home infusion in our own area would save patients like TJ from long travel and waiting times, as well as money for both the parents and the healthcare system.
Beacon and St. Joseph provide home infusion, but not for pediatrics. We'll partner with Beacon Children's Hospital to provide a service that they don't. Instead of spending an expensive period of weeks at the hospital, our patients will receive the same life-saving therapy at home, and hospitals will have more nurses available for critical patients.
We also save ourselves money by hand delivering the medications instead of hiring a service like our competitors do. Quorum, which is CVS's home infusion service, is shutting down, leaving gaps in rural areas that we can fill. We can provide personalized health care for an 80-mile radius in northern Indiana.
When I was 14, I was hospitalized with protracted bacterial bronchitis. After 5 days of intense inpatient care, I was to receive an antibiotic infusion every 8 hours for the next 5 weeks. Luckily for me, there was a service in the Twin Cities where I'm from that provides pediatric home infusion. I was able to spend that time recovering at home with my family instead of in the hospital, and I'm very thankful for that. Having to go to the hospital every day at inopportune hours would have been quite the hassle on top of already having a complex illness. I'm very glad to be a part of a team that can bring such a needed service to Michiana.
For obvious reasons, there are a lot of barriers to starting a pharmacy. But I did recently become a member of the National Community Pharmacists Association and attended their pharmacy ownership workshop where I met Independent RX Consulting. They will serve as our much-needed mentors, guiding us through the complications of opening a pharmacy. They assist with the business plan, location analysis, acquiring funding, real property negotiation, clean room design, wholesale contracts, licensing assistance, and much more. They are exactly the resource that we need to change our pharmacy from an idea to a reality, but at a cost of $25,000 with $5,000 up front. This is a good value for the professional services provided, but still a large financial barrier. Funds awarded from this competition would allow us to begin the pharmacy ownership process immediately, allowing us to begin operations sometime next year. I've been a pharmacy tech for almost 10 years now. Gevorg is a pharmacy manager who will have his MBA this spring. Jack will provide informatics support when he's not focusing on his degree. And Josh has worked for ADEC for 20 years now and has recently named Director of Nursing at WellPath Healthcare. We are incredibly excited to bring such a valuable service to kids in need to our area, and we hope the community is as well. As a team, we are ready to provide expert care and attention to Michiana families when they need it most. Thanks.